Welcome, welcome, everyone. Exciting to see people join. And if you want to just, oh, wow, we see some names, Kara, that we know so well.
Yeah, I
You can send it off.
see.
You see that, right? So
Yep.
Marcia, welcome to our family. You guys know that it's like, welcome to my living room, everyone's living room. If you want to send us off a note where you're calling in from, we always think that's interesting. I'm in Harrytown, Sleepy Hollow, which is so well known during this month. We had 3 cruise ships here this weekend, which was
Oh,
really
it's already starting, isn't it?
already starting. I think,
Crazy.
the only person that wasn't wearing a witch's outfit. So go ahead and find the chat. Everybody's super familiar with this. Go ahead and find the chat.
Yep, lots of familiar names here.
Yeah, so send us up a note so I remember where you guys are. Marcia's a stone throw away from us. You're in the office today,
Yeah,
right?
yes, I'm in the office today.
Wow. Yeah. And with all the awards behind you, Marcia,
Oh, thank you, Wendy. Thank you.
I'm her biggest fan, as you'll come to learn. So yeah, just make sure you can use that chat feature. Because I'm looking for the chats. So I'll say welcome everybody again, because we're gonna have a conversation. Carrie's saying hi. Can you all use the chat feature to say hi to us? Because I'm not seeing it. Carrie, are you seeing it?
No, I am not. I just
Oh,
got
there we
one.
go. Okay. Welcome, everybody. But I'm not seeing. And if you're on the BLI staff, if you want to go ahead and introduce yourself here, that would be great. There we go. Well, so far it's just the panelists. So just confirming that all the guests have access to the chat too.
I did see one guest chat in.
Okay, that's all we need.
Yep.
Oh. Do you remember in the beginning, Marcia, when this was more newer, you would log on so early for every meeting because you were
Yes.
and now it's like, oh, I've got 10 seconds. I've got plenty of time before I log on.
And we have someone who just logged on from Panama.
Yes, that's one of our
Awesome.
Is it the same time zone? What time is it? Is it earlier or later there? If you want to let us know. Good morning, everybody. Good morning, good morning. I think it's morning for many of us. It's 9 a.m. It's the same time as in Panama. I love that part of the world. That's welcome, welcome. We'll be starting in just about 6 minutes. And if you let us know where you're calling in from or logging on, we'd love to, either the location or the organization, how your Monday morning is going. I don't know how we feel about doing this topic, Marcia, on a Monday morning. What do we think? Like, are we mentally
I'm,
here yet? What do we
I'm
think?
raring to go on a
You're
Monday
rare.
morning.
Okay.
I'm raring to go.
Did you walk this morning?
I did walk and I had my workout this morning. So
Good for
Wow.
that
you.
helps on Monday morning. It's always hard thinking about it on Sunday night, I will admit, but I'm always glad when it's done.
I love that.
Yeah, that
That-
just made me jealous, Marcia.
Welcome. I know we have some people from Westchester, which is amazing. We also have some people calling in from Canada. Um, I was going to make fun a little bit.
Yay, someone's going on vacation tomorrow. That's great.
Oh, that is a little stressed about vacation. That's a good stress, though. I'm hoping it's a good stress.
Yeah.
There's good stress. Oh, we have people calling in from California, so thank you. I know it's super early there. We're going to Paris, all over. And we'll just do a quick countdown in the background. Amanda's also doing countdown. So just about 5 minutes to start. I think it'll be interesting to see. So we've got a good chunk now, but let's see. I'd love to do, I like, how many people here like have kids under 10, let's say, living in a family under 10 or 12, say me or not me. How many of you have what I think are younger kids? Two kids under 10. Yeah, that's young. Okay. More me's. And how about teenagers? Put in teenagers. Anybody have teenagers? Both.
Little.
20. Oh, happy birthday. And then there are some that maybe have kids in college or empty nesters. And then I'll say Marcia and I can chime into the grandparent group. Although to me, Marcia's kids are all grown up, but not quite. Not
You've
quite.
got the little one.
I got the 1-year-old grandson. So it's always interesting if you send us some chats about your families, your pets. It's the first time in a long time that Marcia hasn't had a dog. Carrie just got a dog.
Yep, we have a puppy.
That's not a
They
puppy.
keep you active and they're funny.
Very active.
And so yeah, we have people calling in from Singapore.
Yes, I see that.
Welcome. Wow. Okay.
Oh.
Somebody.
I just spoke to someone this morning who's in Japan.
Oh, all the places. Singapore, that's the only place I got was the airport. I really don't think that counts, but I did love the airport.
I've been to Singapore. It's beautiful.
Oh, that little dig in there, Marcia.
Sorry.
That's all right. I'll take it. The competition. If you're a competitive, I'll send it off. There is a very, very fun app called Ben. And my family, we play it. I've been to 26% of the world. My mom has been to 43% of the world.
Wow.
We're trying to catch up. It's a fun thing to do. So again, welcome everyone to those who are joining. Love to hear about your families, your pets, your hobbies, and we'll be starting in just about 2 minutes. Wow, 29, 30, 35, and 37. That does beat me. I have a 32, 34, and 36-year-old. 4 grandchildren under 12. That's got to be a fun family.
And they're in Germany. Did you see that? That's pretty
Yes,
cool.
they're heading to Germany. Oh, the family's in Germany. Yeah.
Yeah.
So welcome.
We love community housing or innovation. Great organization.
Yes. Any of the communities. Oops, did not mean to do that. Don't
Oh,
look.
somebody else shared they have a puppy sleeping next to them too.
Yeah. Yes, mine is back there. That'll be interesting to see whether he can remain quiet on this. Again, if you're just joining us, we're just sharing a little bit about ourselves. Thank you. We're looking forward to hearing from all of you as well. So we'd love to hear about your families, your hobbies, where you're calling in from. Oh my goodness, a whole zoo going on there.
Oh, wow.
Amazing. And we have the numbers growing and growing. And we are going to start in a minute. We do have some cool timers we could have used, but that's all.
Yeah, we're gonna wait for the official words from Amanda, who's in the
Yes.
background, to tell us when she will begin recording.
Would I be dating myself? I would say I remember when we had a synchronized clocks, Marcia. Do you remember before we had to say, does everybody have the same time? Now we're lucky we
Yes.
don't have to do that
Yeah.
anymore. We got Nevada. Aw,
Okay, are we ready?
we're ready to go. We're all yours, Marcia. Thank you.
Great. Good morning officially, everyone. Welcome to this wonderful webinar, Mental Health in the Workplace, Impacts and Action. And I'm Dr. Marcia Gordon. I'm the president and CEO of the Business Council of Westchester. And I know there are many Business Council of Westchester members here, but we are also some new friends from around the world. And so we want to welcome you all. And I want to tell you a little bit about the Business Council. So so first of all, Westchester County, we are 30 miles north of New York City. And we have in our county the headquarters for IBM and Regeneron and MasterCard and Heineken USA and Danone and so many large corporations. And they are part of our organization of 1,100 members. And in addition, we have large institutions like universities and hospitals. And we're very proud that we have over 155 not-for-profits or NGOs or community-based organizations that are very much a part of our economy. And then, of course, mid and small businesses, which make up the bulk of the economy in any community. And we'd like to say that we work for economic opportunity for all in Westchester County and the region. We're in the Hudson Valley region. And we do that by creating profitability for our members. We want our members to meet each other, to grow, to do business together, to be recognized, to learn from each other and get information. And we also work for prosperity for our community through economic development efforts and community development and legislative advocacy. And I just want to say that one of the major leaders in our community is Wendy Wollner, the CEO of Balancing Life's Issues. She is recognized not only throughout Westchester, but throughout the entire country, really, as being a leader in helping businesses find out about work-life balance and in helping them address issues like mental health, which we're going to talk about today. She is a winner of the Business Council of Westchester Hall of Fame, which is a very, very coveted award. Carrie was one of our 40 under 40, one of our rising stars. And BLI is well recognized as one of the fastest growing companies. She's a graduate of Goldman Sachs, 10,000 small businesses. And she guides so many companies on how to address important issues which create better opportunities for employees and better opportunities for themselves. So with that, Wendy, it's my honor and privilege to turn this over to you to help us address a very important issue of mental health in the workplace.
Oh, wow. Okay. Thank you, Marcia. I asked her not to do that. She did it anyway, but we'll talk a little bit more about Business Council because it really fits in perfectly to what we're here today. So if you've been on a class with me before, you've been in one of mine, you know, I always say, come into my living room. Carrie and I are really excited to welcome you here to a conversation that will be some gentle reminders. So you may say, I knew that. And there are going to be other things that really, truly, I'm hoping will be new and different because there are some new and different. So for those of you who've been on a BCW web before, we're going to do it a little different with Amanda and Marcia's wonderful permission and their support. We're not waiting till the end so you guys see that you are calling in from literally all over the world because this is a global topic that affects everybody. So you are welcome to not just ask questions, you are welcome to argue back, you're welcome to challenge. I did just want to take a journey to tell you I was trained as a cognitive behavioral therapist. I have a degree from University of Pennsylvania in therapy, and I did that for a number of years and then went into corporate mental health. It has changed dramatically. So it's interesting because I spend many, many hours preparing for every speech. I'm sure everybody can relate to the idea that you want it to be the best. And I think the really interesting thing is I thought I was ready to go. And then what happens? Marcia sends to me this morning, hot off the presses. This is just out. Carrie's going to go ahead and put the full link in. So we had to change our deck and add that we're very proud of the fact that New York ranked #1. Now, for some of you, you may say, Wendy, why are you putting this in? I'm not calling in from New York. But when you look at the article that Marcia sent out, which is such a reason to be part of a community is because they're always having your back. They're always sending different things. We're always learning from each other. you'll see that one of the things that New York has done right is they've taken this topic super seriously. So I really want to start with a message of very much hope and optimism that even though you hear so many negative things about our mental health, our global mental health, and all of the different things that are hitting us, whether it be social media or whether it be the news or the politics or, everything, breaking news constantly. The fact is, we have a lot of answers. And when we spend the resources and the time and the dedication and the education, we actually do have this compelling proof that we can move we can move a lot of a lot of healthy teenagers. We can change suicide rates, all the things that I'm really passionate about doing. I am hoping one day, while I'm still here and CEO of BLI, that we will change the topic and just talk about health, not just mental health or mental and physical health, because it's all connected. Our bodies are all connected. So one of the things we want to talk about is really how do we learn from New York State and then even surpass it. So quick question for you. We are a whopping 6 minutes in. So cough up a little truth time. It's a little truth serum, Carrie. How many of you have been multitasking while I've been talking? Say me or not me. Go ahead and find that chat. All right.
No.
Everybody's saying me, including some of our BLI staff.
Oh, no.
Are you telling me that I'm boring? Is this a boring topic? How many of you felt the need to multitask in the first 6 minutes? I want to invite you into a little self-awareness journey and ask yourself, what happened that you felt the need in 6 minutes not to just focus on how we can make our lives better? Oh, somebody only made it 3 minutes, Karen. What do we think of that?
Yeah, I see that.
Yeah, I know. I'm not doing a plug for where I got the coffee, but I do have it. So that feeling of too many things to do, and when the camera's off, which we're going to talk about, and stress,
Yeah.
multitasking, I've been away on vacation. I think we really need to talk about the coworker asking questions. All of these things are very real. I appreciate that you're contributing to the conversation. Again, you're in my living room and we're just talking. But one of the goals I have for today is not just to make this about where our workplaces are, our families, but truly about ourselves. And so we need to understand that we do need some time, however many minutes you can truly give us, to just be here now with me. So I get it. It's the end of the day and chilling out. I just think that idea of truly learning when you have to multitask and when you don't is one of the first takeaways. So I will tell you that I'm a caregiver for my mom, who's going to be 90. And so I have what I call a pool of blood. Would you like to hear about the pool of blood rule? How many of you want to hear? Say me or not me. So as a single mom with 3 kids, a grandmother, I do have my phone next to me. The pool of blood is during these times that I think are super important, I tell my family between 10 and 11, you only text me if it's a pool of blood, however you define it. And over the last 30 years, there have been times where they have, and I have answered the phone in front of 5,000 people because it's been that important. But other than that, I want you to really think about the first part about what is your biggest workplace stress. We gave you some examples of global answers. Okay, there you go. Lost a limb. Call me up. Otherwise, shuck it up. I love that. Neurophysiology finds that multitasking is not efficient.
Yeah.
Some of you know I've had some health challenges, and one of the things that I'm learning through it, through my doctors, is if your brain gets too full, it's a little like a pressure cooker, and it's going to go poop. So let's continue down the road of self-awareness. You've got these 4 choices because these are the top 4 global choices. What is your biggest workplace stress right now? Is it how much work you have to do? Is it having it all, work-life balance? Is it people not communicating well? Or is it I'm just really worried about my job? What would you say? And I'm going to give you a minute. Normally we do a poll here, but we're we're in my living room, so just send it off. Can't do all of the above. I'm going to actually.
I was just going to
go.
say, someone shared all of the above.
What's yours, Carrie?
I would say work-life balance for me.
Okay.
Just figuring out all the pieces with, 2 little kids as well. So
Yeah.
what would you say for yours?
It's interesting because I'm really good at
Lots
the
of
balance.
yeah.
And so I think for me, when I say the idea of communication, it's really understanding how it's changed today. So I would tweak the poor communication to say, the example I use is, did anybody work with someone like Carrie role play with me for a second? Ask me the question, do you know what time it is? Just ask me that question verbatim. Do you know what time it is?
Do you know what time it is, Wendy?
Yep, I know.
What time is it?
That's one of my triggers, right? Like, I was asking you what time it is, answer the time.
Yeah.
So I think when you look at it, you'll see we're spending a good 11 minutes on understanding that we are in a serious issue. These are brand new statistics that we're talking about $190 billion of healthcare costs on burnout. And it's agnostic. It doesn't matter what industry you're in. We're seeing a download of productivity in about 23%, which you can imagine how that's affecting us. But 76% of employees globally are saying, I don't feel like going to work.
That's a very high percentage.
Yep. And what's interesting about it, and I will say, when we bring Marcia back on at the end, she and I have very interesting conversations about we're not burnt out. And we're not new kids on the playing ground. We've been here for decades. And so, yeah, I would challenge you not to expect to be burned out, to know there are things we can really do that do change the conversation. And it's really important that we're going to spend the next 40 minutes talking about what do we do about this, right? So we just got off the weekend. How many of you checked emails this weekend? How many of you were on emails?
Guilty.
So this
Looks
is
like a
what
lot of people
almost
do.
right. And I'm not here to tell you that you shouldn't, by the way. I am not here to pass any judgment. I'm here to ask you whether it got you more anxious or it helped you. So for some, they love the idea of, I just want to spread it out. Some people didn't even have a weekend because they were working. So it's really this idea is, did you feel like it helped you be calmer? Did it help you feel like you were moving in the right direction? Did checking in and responding work for you? So say, what grade do you give yourself on starting Monday morning, A, B, C, D, or F, on being in a good place to be ready to go this morning? A, B, C, D, or F? And by the way, if you want to send a private note just to remind you, you can change that just to the panelists. So we got a lot of people ready to go. We got some, Kara, that could use a little help.
Yeah. Yep.
So I could spend an hour on this one. This is probably my favorite slide. This is the one where, for some of you, I know you know this, but for others, I'm really going to encourage you to be here now. And being prepared for what's coming is an amazing skill. I think it's one of the values we have, especially for leaders, to say, I'm good. I'm good with whatever curveball hits me. But trained as a cognitive behavioral therapist, let me just remind people, right? Your thoughts become your behaviors and your behaviors become your actions. And so for those of you who chit chat, who may talk about the weather or may talk about, something that is what we call a very benign topic, which is just a chit chat. One of the things that's interesting about it, it really has no value. And time is really important in terms of overcoming burnout, in terms of our mental health. We get 168 hours a week, so we got to use those times. So I'm really going to encourage you, starting at this minute, to really think about what kind of conversations can you have with one another that really, really open you up to how are you really? How are you feeling really? What is overwhelming you? And it's really interesting because, again, it starts with curious here. Let's do a quick question. How many of you had families that you grew up in that talked about mental health, that talked about things like suicide awareness or firearm or religion or politics or money. How many of you grew up with homes that were really open to every topic, sex, drugs, rock and roll? No, I'm kidding about
I
the rock
don't
and
see
roll.
any yeses.
Yeah.
I'm seeing all no's.
Some. So we have one or two. I think it's
Yeah.
interesting because some of the counselors, the social workers, maybe. So I mean, first of all, we have to give ourselves a break, right? We didn't grow up like that, and so that makes perfect sense why some of us may have it. And somebody saying, "Not until I lost, not until a family member died by suicide." A lot rock and roll, yes, but everybody else, everything else, no. So I'm going to tell you a big takeaway from today is that's what you need to learn. That is on your, suck it up and finish your soup, no crying in baseball attitudes. So normalizing mental health conversations, asking people, have you thought about harming yourself? Have you thought about, here's one that I think is a really important conversation. I'll show you something I try to do with my team pretty regularly. I'll say, Kara, what are you looking forward to? So Carrie, what's coming up in your world that you're looking forward to?
I'm looking forward to my sister's upcoming wedding.
Very exciting.
Yes.
Weddings. So, as a human being, as a leader, if somebody says nothing, then we know that that is a very real red flag. Talking about things like, I seen this in a speech the other day. Many of you know how close I am to my mom. If you follow me on social media, she's always on social media with me. She's been on trips with me. We go all over. And when I talk about my anxiety about when she dies, and somebody said, well, what do you mean when she dies? It's not if she dies, it's when she dies. It's
Mhm.
part of normalizing conversations. We were going to play the Jelly Roll song, I'm Not Okay, but I'll be all right. I'll put insert little link there if you can, think about it. I spent 4 minutes on this slide. The number one takeaway is don't be afraid to have hard conversations. I ask my children regularly, there's 32, 34, and 36 now, have they ever thought about ending their life? Do they know anyone? Are they concerned about, and fill in the blank? Are they worried about money? Are they worried about their relationships? Have they been in a dangerous situation? And I want to tell you, it never gets easy for me. It never gets comfortable for me. I never feel really good about it. But when I do it and I realize that relationship gets much closer and I feel much more secure in that relationship, I realize that it's the right kind of conversation to do. Yes, Australia has a real mental health problem. And that link that was just shared, thank you. Shout out to one of our global trainers. Um, and some people are sharing that they also had a similar relationship with their parent, and their parent recently died. And they live a life with no regrets, which, by the way, is what I would call, if I were to rewrite my book, I would always say it's a life with the less regrets, meaningful conversations. So, Carrie, do you want to just go ahead and paste that link again?
Sure.
One from the trainer a few minutes ago.
Yeah. There you go.
And so this is a local person got a call this morning with an attempted to end their life. And there's more information there from NAMI, which of course the National Association of Mental will put that link as well. I
Yeah.
love this. Yep, Carrie, you need to send it to everyone. Just resend it. So now let's move on to so talking. But let's talk about some micro bit breaks. I say this because, I got a dog solely for this reason. I'm going to tell you a 1 second story. Well, let me ask you, who's ready for story time? Anybody ready for story time? Maybe take a sip of coffee or tea. Who's ready for story time? Ah, come on. That's a really good way to get you guys off your emails for a minute. A very real personal challenge that I had a number of years ago was my parents were in a terrible car accident. And it was a very difficult time for me. They were both helicoptered to the local Westchester Medical Center. Shout out to them. They were amazing. And it was just, if I felt overwhelmed before that, that was a moment in my time. I really felt like I couldn't get up. They were in different parts of the hospital. My mom was more seriously hurt than my dad. I could go on and on. And I thought what was interesting is that people really gave me advice about making life easier and doing things differently. And none of it actually helped. It was actually my vet who said, you should get a dog. This is the time for you to get a dog. And I was like, are you like, I can't get a dog. I'm parents. I'm a mom. I'm a single mom. I have two stepkids. I mean, getting a dog. Why did he tell me to get a dog? Tell me why that was the best advice ever to get a dog. Why was that so helpful? You have to walk it. So it's very personal to tell you, for some people, getting out of bed is really hard. For many of us, we understand that. That idea of just getting up in the morning when you are facing many different things or small things or big things, it's a war. And they absolutely calm you. I love it because some of you that I wish you would follow each other on social media, all of you, because you'll share about your animals. My older son is at Mayo Clinic and their dogs have little business cards. So micro breaks. However you get out, whether it be walking meetings, whether it be mindful minutes, whether it's meditations, quiet rooms, deep breaths, any of these. But what's really important to acknowledge is it isn't always making your life easier. And that is something that the media has not done as good enough job at. You know, this idea of taking everything off your plate, that actually can be the worst thing for your mental health. Look at what you haven't done there. Yeah, let's talk a little bit. We're going to get to that comment about sympathy in a minute. I also want to really, again, talk about if you're leading in an organization, I will say here at BLI, we do safe spaces where we are just able to share anything. I know this is a very controversial thing to talk about today because certainly we're very divided in this country. Many of you are calling in from other places. But the idea that I can just share my opinion or my feelings without any judgment is something that is so important that I'm not going to have people scream down my throat and that I am just able to say, this is what I think and feel, and sharing resources. So let me take a minute and say, I don't know how many of you know that Jane Goodall passed away last week. And I watched her documentary. Actually, Marcia and I are always sharing. Did you see this? Did you watch this? Did you see this? Resources are super important. So I'm going to invite you to put in a good book, to put in a good Netflix series or Hulu's or Amazon Prime, any kind of resource that you were like, that totally helped me. Go for it. Go put it in. I'll put mine in right now. I recently went back to school at Harvard. It was an amazing class, so amazing that Carrie and Daniela are taking it with me now, right, Karen? How do you like
Yeah,
it?
it's wonderful. Love it.
Is it easy?
No,
Good.
no, no, no,
Not easy at all,
no,
right?
no. It really makes you think, and it's tough, but
What does it make you think about?
makes you think about past, present, future in all areas of your life, what you've been through, how it's affected you, how you change from it. So, lots of introspection.
And a lot of what we're talking about today is our own mental health and our own, are we living our best version of our life? Are we happy? And
Yes.
that's what the course, the class is about happiness. Largest study ever done, Harvard. And by the way, the class is from Harvard Business School called A Good Life. I love these resources. We're going to capture the chat and we'll send them out. I'll tell you that I really, really, really like the Chilean miners movie about the miners that were trapped. I also thought the Thai caves movie. These are true stories about people that were able to get together as a group and be able to do things that nobody thought could be ever done. Unbroken. Oh my God, yes. Oh, a close friend of yours. Okay, interesting.
The Mountain is You. Have you read that
I
book,
have
Linda?
not, but I
I'm gonna
love
write
this.
that one.
I
Yeah.
love this because there's so many yes, physical and mental health go together. You're going to see, by the way, Dr. Sandhya Gupta is doing a lot of new research about pain management and correlation between our mental health and pain are physical. So let's talk a little bit about flexibility. That is certainly the hot topic. I recently attended Fast Company, sorry, they have an innovation festival where really there were thousands of people there. I think what we have to acknowledge is we haven't gotten this right yet. We don't really know the answer. I will tell you that here in Westchester County, retaining the best and the brightest talent, which can sometimes be a challenge here. This slide is written for that, really truly saying, what do you need to do to keep the people that you want? Carrie's been with me, I don't know, 14 years, which is like in dog life, like 120 years. And when they were thinking to move, well, when they did move, the first thing I said is whatever you need. She lives sort of in the middle of nowhere. You go to three stones and make a right and then a left. And it's so when you're looking at flexible options, really think about talent, what your company can do and can't do, and how you can make it work. I would also just put a big plug in here. If you're not great at using your phone, Carrie, can you share with everybody what do I say almost on every single staff meeting?
Work from your phone.
But get your
Work
phone
from your phone and learn how to do it. Most important.
it's not easy, especially if you update it to iOS 26, which is a whole different way to look at your phone. It's really a challenge. So if you're going to be there, I shouldn't care. As a CEO and leader, the work should get done beautifully. And that might give you the flexibility that will say you can take somebody to a baseball game, or you can take somebody to the hospital if you need to be. And, however you need to make it happen. I mean, of course, the ideal is that you do one thing at a time. But in the real world, when we're talking about it, flexibility isn't about being lazy. It's about being human.
In fact, I'll share a funny little story that happened Friday. Wendy called me at the end of Friday afternoon on Teams, and I answered from my phone sitting outside with my dog. And the first thing she said was, "Oh, I'm so happy to see her outside." And I have a puppy that I was taking out. So
Puppy, that's a huge puppy. So a few minutes ago, somebody said, let's talk a little bit about sympathy and empathy. This is certainly one of my areas of specialty. I've been lucky enough where I did I did study with Daniel Goleman, who many of you know was one of the starters of emotional intelligence. Although really, to be honest, there were three gentlemen out of Yale, Salve, Mayer, and Caruso, that actually did found emotional intelligence, and Daniel Goleman sort of took a right turn. So we will definitely share the chat. We're going to put together a resource with all of these because there's so many great ones that we want to do a shout out to. But for those of us that are thinking about this whole theme of talk, share, have really deep conversations. I do think the comment that came in a few minutes ago, we do not use the word sympathy except when what? So you fill in the blank for me. When is the only time it is appropriate with a colleague or a coworker or a loved one to use sympathy? When what happens? When do we use the emotion sympathy? Yep, death. We do when there's a death or a very unfortunate, terrible diagnosis, we say, I really feel badly. So the reality that's redundant, the reality of sympathy is it says, I feel badly for you, I pity you. So when we use empathy, we say, I want to try to understand how you feel. So I'm going to teach you, or we're going to talk about, and some of you already know this. I was trained and if you ever watch Shrinking, does anybody watch do you remember the TV, the series Shrinking? Anybody see that funny, it's a story about therapists. Anybody see Shrinking? Yes. Oh, we've got, yes, I love it. It's a great show. So you'll notice that Shrinking sort of made this law really very well known. And it's called The Empty Chair. And I have to do this a lot. And my older son, who's a surgeon, I don't know anything about his life. It seems very disjointed to me. I don't really understand what his life is like. And so we do something called the empty chair. It's Gestalt, if you recognize it, because there are many therapists that have joined us. So I really get up and I say, okay, I'm not going to be Wendy now. I'm going to be Daniel. I'm going to play the other person. So if you're a leader, this is a great thing to do. What can I understand about your life? What do I need to know about your life? That is the definition of empathy. And if you don't know enough, then that's the conversation you have to have. And I'm going to ask, Carrie has been gracious, has shared with many people on podcasts and everything. She is this incredibly gorgeous, brilliant, chief experience officer of BLI. But what is something that people wouldn't know about you, Carrie, that has a real impact on your life?
There's probably a few. I would say you would look at me and you wouldn't realize that I deal with a chronic illness, an autoimmune disease that is very rare, can be very severe, and there is no cure. So something I deal with every day, which even some of my closest friends will look at me and say, how are you so sick? It doesn't make sense. So that would be one.
And thank you for sharing it. And it's something that we have as an organization understood and worked around and listened to and tried to be educated. And it's part of our responsibility to say, what do I need to know to help Carrie? And people are thanking you for sharing, which I agree. So let's talk about, as we close to where chit chat, there's a lot of return for investment. Interesting enough, I'm very proud of the fact that these are brand new statistics. Oops, sorry about that. There we go. We are a science-based company. We are research oriented. And you'll notice even some of these are our clients. You're talking about, and that was the New York State article that I started with is, I know there are cynics here and there's cynics out who say, yeah, you know what? Suck it up and go to work. Carrie's illness has nothing to do with me as a boss. And I recognize that they're still very much a part of our world. I don't feel that way, but I certainly work with people who feel that way. And for those of you who might feel or work with people, know that you're going to get a 4 and $1. So for every time you work on any of these, talking, moving towards, you're going to come out in a much better, profitable way. And so every dollar you invest, you get $5 back, more than $5 back. This is a $1 trillion investment from a global point of view. So anything that has to do with preventative healthcare, anything we can do to make us a healthier organization, both mentally and physically, is what is best for our healthcare costs, which is quite frankly the number one reason that the government is shut down right now, is over our healthcare cost issues. So the most common objections to what I do for a living is we can't afford it, it's soft, and I'll never understand whether we're successful or not. I do want to just say a little bit about this slide. You know, this is a very cold slide. It's a fact slide. It's the way it is. You do this because your company, your organization, the world will be in a better financial place. But I don't want people to walk away and think this is why I started BLI, because it's not true. The truth is, I am very proud of the fact that we help people discover ways that make their lives more meaningful. And I agree with the last slide. I don't know that I can always measure that success. You can measure it in thank yous. You can measure it in your own children, in your own relationship, in your own role modeling. So I don't know where you fit on this, and I did want to sit and percolate this for a minute. Do you find this interesting? Is this what do you feel about the buy-in for this topic? Where are you all on this? Can you send me off some of your comments or thoughts? Interesting, not interesting, relevant, not relevant?
I'd be curious to see what
Yeah.
people think. Valuable.
Yeah. Now I'm wondering, are people multitasking right now? Okay, letting it sink in for a minute. Yeah, I think the interesting thing about this conversation is we're all becoming part of the sales team, which I never thought I would be, but we really are. Cause and effect. Yeah. Does anybody have a work environment? You can share this obviously privately, where you don't feel that this is a value, that this is as important in your work environment as you feel like it should be? Anybody hoping that they'll see a better or more calmer 2026? Yeah, I agree. So some of you will recognize from this slide, there's a need to reach younger generation. I think it's interesting to see that. Thanks for sharing that, because we're really interested to see, it looked like the mental health, the younger generation very much embraced therapy. And I totally agree with, in the Asian cultures and APAC, it can be a challenging topic to be honest about. That's certainly true. Culture plays a big difference and a big role for sure. Pressure, stress, success, all of those are part of it. It's part of my previous career, and it was a major factor to my decision to retire. I'm going to get out of here. Um, that I love rebranding. I think that comment about I'm not going to call it therapy, I call it coaching. I think rebranding is super important. We really try to do that here. Like, just come in the living room, like really just put your feet up and let's just share our mess, because that's what we're talking about. I will also say to you that there are many, many, many different ways to become mentally healthy. You know, you can do it alone, you can do it with a friend, you can do it, you know, there's not one path, but absolutely that NutriBullet, which just came in from someone, education, let's learn as much as I possibly can, critical thinking, how do I see myself differently, discourse relationships, absolutely, ending relationship. We're seeing a huge change in marriage. Now, maybe I'm interested in that because I'm single at this point in my life. I never thought I would be single, but I am single. And it's not that I would shout that out, but you know what? There's pros and cons to everything. And so when we're looking at what makes somebody mentally healthy, I do think this slide is we are not robots. Yes, I used AI to help me a little with this because I'm super interested in AI. I'm 2.5 years into my certification. But at the end of the day, Carrie and I go through word by word by word and we say, does this feel right? Does it look right? Does it sound like us? Does it have our branding? Does it energize people? I am very, very, very strong about the middle. And that is whoever you influence, however you define leadership, whether it be as a parent, a daughter, a son, a community member, I think that that second slide is really important. Some of you know that I don't drink anymore. I haven't had one sip of alcohol in 3.5 years. Um, I do like mocktails. I've become a fan of some very, and Carrie, how often do I talk about not drinking?
Often. I
Yep.
would, yeah, definitely often.
And I want to make it part of our conversation because I still think that some people, you know, I stopped drinking for health reasons. I can tell you that I felt extremely pressured at certain situations to have a little glass and just a sip. And so I want to look at model healthy behaviors. It doesn't mean I think you shouldn't have a drink. That is totally an individual decision, but I want to model healthy behaviors. Um, if we're adding to the Marshall list, she'll tell you that she got up and went for a walk. And when we go away together, which I'm lucky enough to do, I try to keep up with her. She's a very fast walker. I do have to tell that. She's a very fast walker. But it's not just I'm talking about it, I'm doing it. I'm looking at health. I'm looking at my sleep. I'm looking at, and I'm really very much including that in conversations. And that's what ultimately, that's the Brene Brown. Of course, many of you read her book, and that's one of the certain options. Between 50 and 60, release from tolerance after 60. That's interesting. Very little tolerance for alcohol, you know, that feeling in the morning. But I think it's interesting that here in America, the younger population is drinking the less they ever have. I know we could talk about cannabis and we could talk about CBD and all the different options. Again, I'm here to learn, but the second one is I want you to give yourself a grade. A, B, C, D, or F. How healthy are your behaviors? And you can send it just to Carrie and I if you want. Okay, we got some, I love it. We got some really honest people here. I always think it's funny. Remember in school, I got A minus over
Oh,
B plus. So some good, some decent grades, which I appreciate. I appreciate people taking the time. Ah, nobody ever wants to hear from anyone who never struggles. I totally agree with that.
I would
I
agree
had
with
the
that too.
pleasure many years ago, but I met Martha Stewart. She's a local person at a networking, and I was married at the time, and we were celebrating Christmas. And I said, "Oh my gosh, I cut out your picture. I'm going to do my Christmas tree just like you, Martha. It's going to look just like you." And she started laughing. She was, "Are you kidding me?" She's like, "Wendy, that took 20 people and thousands of dollars. Stop comparing yourself." And that was just a light bulb that went off. So where can you go from here? We really wanted to make sure that you looked at it, offer some kind of mental health training, whether you can afford it or not. There's a ton of free resources as well, but continue this. You'll have this link, share it. Remember that confidentially matters. So office gossip is at an all-time high. If somebody does share something about their family situation, it's really important that you have an entire culture built on trust and action. Kara, if you can put in option B as a resource. I am
Yep.
not the biggest Sheryl Sandberg fan, full disclosure, the CEO of Facebook. I didn't even love the book Lean In, to be honest. That wasn't something for me that spoke to me. But if you remember, she went to Mexico and her husband, David Sandberg, had a pulmonary embolism and unfortunately died. And she wrote a book called Option B. And what is really interesting about it, it's a great resource to say what you can do, what you should do, what you might do, how we can offer support during really, really difficult times. Um, when I share around empathy with my clients, what does frustration feel like for you? So this is a great chat from someone who is a licensed counselor. So I'll let you read that. Eliminate the shoulds. Do not should on yourself. And again, I think, to the best that we can, my tagline is I'm perfectly imperfect. So your team, and again, your family, your team is to be the best version of yourself. So how do you get started? Um, for the leaders, ask yourself how comfortable you are. Ask yourself how much training do you need? How comfortable are you in the suicide awareness, in the suicide prevention? How comfortable are you asking people, would you think about hurting yourself or hurting others? Do you have access to a firearm? Because we know firearm safety. I am not being political. I am stating a fact. Firearm safety. Where is the gun if somebody is having a really difficult day? That's what week one looks at. Week one challenges leaders to say, how do I feel about this topic? And then week two is do a check in. I try to involve you in this conversation as much as possible, but you having some kind of survey, some kind of, what do you say to people who think the workplace is not appropriate? It's interesting. So thank you for asking that. I added the slide about the sales. I'm going to date myself here. I worked at Hertz right out of graduate school from Penn, as I mentioned, and I worked on one of the very first affirmative action cases. And this conversation came up, like, how do we talk about the value of any kind of thing that didn't seem like it was a part of work? And what's important is it's all the way from the return on the investment, the cold fact numbers that we save money when we do these trainings. We prevent things that are very costly within our work environment. We retain better talent, which is incredibly important to our goal as what is our responsibility as human beings. And then you pick where you fall on that. Your sales pitch for this is got to be real. You can imagine where my sales pitch is, right? You can sort of feel it, I hope. I would encourage you to look at where you're living. What are the policies and benefits? New York State, you saw we started this. We're rocking it in this because it's a major, major, major part of our government plan. But you may be in a state or a country where it's not. And so you need to be aware of that. And then you start launching support programs. And I'm going to tell you something here. I want you to be incredibly innovative. I want you to try things and then I want you to fail and I want you to try more things and I want you to fail more ways because that's what support means. I'll make it personal about why we decided to co-sponsor with the Business Council. There's a saying, how many of you have heard it's lonely at the top? How many of you have ever heard that? It gets really lonely at the top. Me or not me? Anyone hear that? Yeah.
Yeah.
Many leaders that I coach say, I'm all alone. And I can tell you, decades ago, before the Westchester Business Council was anyway that it was, I was really feeling very scared about this whole process and overwhelmed. And those are real mental health feelings, right? Those are big emotions. I'm overwhelmed, I'm scared, and I'm I don't even know where to start. It's almost like, my home. Actually, it's Carrie's sister who comes to my home and she'll just organize it for me because I need that. And Marcia sat at the local diner at City Limits and just shared with me a very personal story. And I was like, oh, okay, she went through this. I can go through this. And decades later, there are times where I will call a colleague who's become a close friend to say, how can we support one another? It is a real way for you to join communities, to be an active community. If it's religion, if it's organized religion, if it's spirituality, if it's a running group, that's what Peloton did. If you read their business plan, they created a community. I'm not here to be any kind of judgment, but what I am here is that to say a supportive culture in many different ways is incredibly important. There's some really interesting studies. These are brand new, as you can see, 2024, Microsoft, Aetna, and Johnson Johnson. You will get this. And you can see that the more that, for those of you who are saying, how do I convince people, you're going to see more and more case studies on why this has such a real impact. I'm not a reader from the slides, so we'll also send this deck out with the link as well. If you're staying here, they are great numbers. If you're staying in the sense, I want to do one that has come out lately, and that's the phrase, do you have 8 minutes? So 8 minutes is called a reset. And very personally, I'll tell you, I've been doing this with my mother. I don't always have the patience and time for her. And I've realized that 8 minutes is a really long time. And I didn't realize how many 2-3 minute conversations I was having. Now I have more meaningful conversations. So we do know that, and Jay Shetty has talked about this, and there's a lot of controversy about Jay Shetty. I certainly recognize that none of the people that you may follow are perfect people, but they have good points. And Jay Shetty happens to be one of them. He talks a lot about this vital mental reset. And I would encourage you to set a timer and say, you know what, we're not going to talk about work. For 8 minutes, we're just going to talk. I love people that are leaders that are saying, I like being more in touch with patients. I still do, but not the level I used to. And I'm going to work on it. And that's what the purpose of today was. The purpose of today in 49 minutes is to invite you into a conversation, to continue learning, to continue embracing a topic that we are really learning more and more about. And that is, how can we explore the resources and the commitment to connect to one another? And for those who are saying employees don't want to share, I have to push back on that one. I really have to push back and tell you my experience is that they're scared. They may be anxious about it, but they may not feel safe. But once they change around, how often, Carrie, do you and I hear, I didn't think I would share that, or I never told that to anybody before. And, I think it's just a question of how many children you have. Can anybody think about why that question may be difficult? Well, why do you think that question is considered to be a very personal question? Let's brainstorm for a minute. why is the question, some people can't have children.
Right.
Fertility, big issue today. A judgment. I have 10 kids. I have 7. We had a trainer many years ago who had 17 children, and people had very strong things. Many have a child that have died.
Lost a child. Yeah.
Right. And so as we learn a miscarriage, we run entire programs on that. Absolutely. If you say you have kids, you'll think you need more time off. You can start to see that there's so many things that go into. And so that if we haven't created an environment, and the struggle for fertility, 2 of my 3 children are fertility drug children. I don't even know if that's the right way to say that, but you know what I mean. And I can tell you the process of taking those fertility drugs, it affects you mentally, it affects you physically, it affects you. We got a nice pat on the back. About 8 minutes is a practice and rewiring of attention. Eye contact post-pandemic is a curious thing. Totally agree with that. So some of the rules of meetings are always leave people wanting more. Always know when to leave a party, never go minute to minute to minute. So we covered about a year in 51 minutes. I think I'm going to invite Marcia to come back on to say some closing words. It's always an honor, really, to be at any Business Council of Westchester. And we're going to put the website in for the Business Council of Westchester, Marcia, for everybody to learn a little bit more. But before she speaks, I also want to tell you there is a entire wall of awards behind. But one of the things that's important is to have friends and colleagues that you admire and you look up to. Whether you call them mentors or sponsors, they're energizers. And Marcia recently was a recipient of a Corning Award, which she knows. I think I'm her biggest fan about this. I don't know if I could compete with Eli, her husband. We got to be in the top 2, right, Marcia?
Top 2. Yeah.
Yeah. And partly because when you have people in your life that can do things and really truly are the type of people, it's incredibly motivating. And that's what I hope that our world has shown you. You can do things you never thought you could do. And so I'll let Marcia brag a minute. She doesn't like doing that, but I'm going to invite her into that, as well as put in the Business Council of Westchester website so people can learn more about it as well. And Marcia, thank you for inviting me into your office today.
Well, I have to tell you, Wendy and Carrie, you are, thank you, Amanda, for putting up that website. You are really incredible. And one of the ways that we kind of measure how we do is that all the people who came on, and there were well over 100 people on, have stayed on listening. And maybe some were doing other things but that's okay, because what we learned from you is you validated that talking about mental health in the workplace and addressing it is important. And I do run a business organization, so I appreciate that the ROI is addressed, because it's important. It's important to say, this will make your business, your organization do better and gain more return on the investment that you're making to care about your team members. And you also provided us with concrete tools that, in between inviting us into your living room, which you did and we appreciate, and it's a beautiful living room, I've been in it myself, you gave us tools to begin as business leaders and as organizational leaders and as human beings to talk about mental health and to address these issues and some of the obstacles and why it's okay to push forward. And when you talk about people who have held people up, I'll tell something personal about Wendy. So I'm a fast walker, but I'm not so good in certain instances, like walking over the bridge on the River Kwai when there's a pack of feral dogs on it. And Wendy Wollner held my hand throughout and has held my hand going down slippery slopes in the world and in life. And when you can find people like that, starting in your business life, as Wendy and I did, but then moving to your personal life, that's what this is all about. And it's about mental health, and it's about being there and holding each other up. And so
Yeah.
I thank you so much for sharing that on the Business Council Westchester Balancing Life's Issues Partnership. And we are partners. And Wendy has an equal amount of awards. She's just not showing them. But you are, and your team at Balancing Life's Issues are such a great asset for the community and for every one of your clients around the world. So thank you so much. And thank you all for participating today, and keep in touch on this topic. I can't wait to learn, to hear what people have learned.
Me too. Thanks, everybody.
Thank you.
Bye.